Hello, Dr. Uthman. Please keep my name private. I am now 30 years old. I had inserted a coil, this thing you call IUD, 4 years ago, but I went to the doctor because I wanted to remove it, and the doctor said he cannot say it. So now I'm wondering, where can it be? Where could it go? Can it go to other sensitive parts of my body? Please, I want you to help me because now I'm really confused.
There are a lot of confusions in our communities concerning IUDs, and as asked Dr. Uthman, this is where we are supposed to come out and clear this air. In this video, we are going to learn, number one, what an IUD is, when is it inserted, where is it inserted, who inserts it, how is it inserted, and the side effects of this IUD.
Ask Dr. Uthman on Sawa Wall.
Dear my viewers, an IUD is an intrauterine contraceptive device, IUCD. By intrauterine, we mean something which is within or inside the uterus. Contraceptive is something that can stop you or that can prevent you from getting pregnant. A device, it's a plastic rod. So an IUD becomes a plastic rod that is surrounded by copper wires, which will prevent you from getting pregnant if it's inserted within your womb. How does it do it? Because it has copper, once it is inserted into your uterus or your womb, it releases copper ions, and these copper ions lead to secretion of cervical mucus, and this cervical mucus will prevent the sperms from proceeding into the fallopian tube for fertilization, and therefore this IUD does its work by stopping fertilization to take place. Who uses this IUD? Any woman of childbearing age. By childbearing age, I mean from 12 years up to 49 years. Actually, to some people, it's different. Therefore, take this. Any woman who is undergoing menstruation can use an IUD if they do not want to give birth or if they want to rest childbirth. That is a person that uses an IUD. There are several questions from the public. I am HIV positive. Can I use an IUD? Yes. If someone has HIV or is having AIDS and they are taking their ARVs very well and they are clinically stable, they are allowed and they can ably insert an IUD if they don't want to give birth. Also, if someone has HIV, is not taking ARVs, but is clinically stable and has no any problem, is okay, they don't have AIDS, because we understand the difference between being HIV positive and having AIDS. So if this person has HIV, not on ARVs, they can also use this device. However, if someone has HIV, is having AIDS and is not clinically stable, by not clinically stable, we mean someone who is down, someone who is bedridden, then we would say first hold giving an IUD until the person stabilizes. One of the biggest fears most of you people have about this IUD is how to insert it and where it is inserted. Actually, I understand that when I was saying it is put inside the uterus, most of you thought that we cut someone and then press the IUD there. But on the contrary, we don't do that. It's a very simple procedure which takes like 5 minutes. This is the IUD we are talking about. It looks like this. And we are going to look at exactly how this IUD is inserted. We have this lady. Now, most of you there, I want you to put your hands up like this and fold it very well. When you fold your hand, you'll make a fist. The size of your fist, please try it out there. The size of your fist is the size of your uterus. And therefore, if you want to know the size of your uterus, just make a fist like this, a very good fist, and this will be the size of your uterus. Therefore, we are going to use this to demonstrate how we can insert an IUD. Now, we are assuming this is our uterus. This is the cervix, and there is an assumption. Please put it in your minds that here we have the fallopian tubes and then the eggs somewhere there. So we have the fallopian tube, this is the uterus, and this is the cervix. Now someone is going to ask me, where is the V? The V is somewhere here. So this is where you people have your activities, and this is the cervix, uterus, and the fallopian tubes. So how we insert it? We are going to get this IUD, but before we insert this IUD, we have to first measure the length of an IUD by using a uterine sound. So we are going to insert it like that, and we measure the length of this uterus. Why are we measuring the length of the uterus? Because we do not want to penetrate or injure the uterus. We want to give you the size or the length that is exact your uterus. So like for this lady, she has 7.5, and therefore it's what we are going to measure and insert an IUD that is of that length. So this is now our IUD. I told you this IUD is supposed to be inserted by an expert. It is inserted by a medical personnel who knows how to insert it. Not everybody is supposed to insert this IUD. Therefore, this is our cervix. How are we going to do it? We have this instrument. This instrument is called the speculum. It is going to help us to open your V. When it opens your V, we are now able to look at the cervix. So because we are able to look at the cervix, we can now insert the IUD like that. After putting it like that, we remove this. This big stuff comes out, and we remain with the device alone. Now look closely. There are these threads that remain outside. We don't leave them to just hang like that. What we do is that we cut their length and we remain with a short length. And this short length is what we fix into the fornices of your cervix. We put those threads somewhere there, and there you have your IUD inserted into your womb. So after inserting this IUD, it can protect you from getting pregnancy for up to 10 years. However, you can still remove it at any period of your choice. For example, your target may be 5 years. You want to stop giving birth for only a period of 5 years. Therefore, when you reach 5 years, you can go back and it gets removed. 2 years, 1 year, any time of your choice, you can take out this device. How do you do it? You again go back to an expert, to a medical worker, to remove this IUD. Like in the question we are seeing, this lady inserted it for 4 years and she wanted a removal. How is it removed? So we know that we inserted it this side and the threads remained outside. Therefore, we just hold these threads and remove it out gently like that. This is how an IUD looks like. I told you it is a plastic rod with some copper around it, and it is T-shaped. So here we have removed it. Now we need to understand what happened to this friend of ours who went to the doctor and the doctor said he is not seeing the IUD. What happens exactly? Now look at this closely. When we insert this IUD, we again demonstrate using this. This is an IUD inserted. After inserting this IUD, it spreads outwards like that. I told you these are the threads. We cut them short, and when it's time for removal, we just ably remove the device like this and take it out. Now what can happen for you, for your doctor to tell you that he's not seeing the IUD? Number one, sometimes this IUD can get out. It can get out. How can it get out? We inserted this IUD, it is already there. Now, for some women who have heavy menstrual bleeding, they have heavy blood with clots. Sometimes this IUD can be pushed downwards. The clots can push downwards and it gets out. So if it's this kind of woman who usually checks her pads before throwing them away, you will be able to see this device in the pad. However, if you don't check, it means you'll throw it away when you are not aware. Some other times, it is just the strings that break off. The strings can break off. How? During menstruation, the strings can be wet. If they are wet, they can easily break off. Not all times, but in some incidents, they break off. So after breaking off, they will be into your pad, and then the device or the IUD will remain in your uterus. And therefore, when you go to the hospital and the doctor checks by visualization, will not be able to see the strings. Now, if that person is not having enough expertise, will not understand that probably the strings just broke off. Now, what are you supposed to do is to do an ultrasound scan. This is simple. You don't need to panic. You don't need to panic because this device, the IUD, cannot go anywhere except getting out or the strings get breaking off. Therefore, do an ultrasound scan. The scan will be able to locate the device, whether it is there or not. One, if it is there, then we can go on and apply another method of removing it. It is simple. We also have another method by using a crocodile forceps to remove that IUD. So rest assured that we shall remove this IUD even when the strings are off. However, if the scan does not see your IUD, still don't get confused. This IUD moved out, it went out in your menstrual blood, and therefore there is no reason for worry. What are some of the side effects of this IUD? After inserting this IUD, some people develop cramps, abdominal pains immediately after inserting, and at times you can have some little bleeding. Then after inserting it for some long time, some women will develop irregular menstrual cycles. Actually, some will have heavy bleeding and then others will have prolonged bleeding. This shouldn't worry you because it usually happens in the first 2 to 3 months and then your menses stabilize. And also just know that it doesn't happen in every woman. You'll find that 1 in 1,000 of these women will develop such menstrual disorders, and it only happens, like I've told you, in the first 2 to 3 months. If it persists for more than 3 months, then it could be some other problem and you need to investigate by doing several blood tests, scans, and so on to find out why you are heavily bleeding. Or else there are some other women who are hypersensitive. By hypersensitivity, we mean their bodies react to copper. And those women will also have a problem with an IUD. But these are very few in the world. Therefore, you should use an IUD without thinking about such issues. As we are concluding this, there are key points you are supposed to take. Number 1 is that an IUD is inserted into your womb or your uterus. Number 2, it can work up to 10 years, but you can remove it at any time of your choice. Number 3, an HIV positive patient can use an IUD provided it is stable. Then number 3, an IUD does not cause infections. Actually, we've seen several people who get pelvic inflammatory diseases, all those infections in the uterus, in the fallopian tubes, and think that it is an IUD that caused the infection. However, it doesn't. IUDs do not cause STIs, sexually transmitted infections. Everyone knows how they get sexually transmitted infections. It is not an IUD. However, if someone has an active pelvic inflammatory disease, or if you have an active STI, like you have those foul-smelling vaginal fluids, we do not give you an IUD. We have to first treat the infection, and then you get an IUD. Because even after all, you will say that it is that IUD that gave you an infection. Then something else you need to understand is that you can have your sexual intercourse very, very well with an IUD. We've seen several people saying when the IUD is there, I cannot have my sex and so on. No, you can have your adequate sexual intercourse with an IUD. Actually, if your husband says that is feeling that IUD, is feeling something pricking him, if you are after inserting an IUD, then just know that it was not properly inserted. You need to go back to your doctor for a checkup or for a reinsertion. You need to understand this. An IUD will not protect you from having STIs. Therefore, if you have an IUD and you play unprotected sexual intercourse with someone who has HIV and STI, you will contract it. Therefore, if you don't want to contract it, use a double protection, and that's where we advise you to use a condom to protect you from getting any STI. And also understand that an IUD, like any other family planning method, is not 100% accurate, and therefore there are very, very few women that will come and tell you that they got pregnant yet they are using an IUD. But these are very rare incidents that should not stop you from using your family planning method. However, this is some of the good news for people who insert IUDs. Apart from preventing pregnancy that you do not want, an IUD can increase your vaginal fluids. Actually, some women, most of them that use IUDs, report increased vaginal fluids, and I think it's good news to some of the women out there. Thank you very much for watching Ask Dr. UTHUMAN YouTube channel. Ask any question of your choice from all our social media platforms, and please do not forget to subscribe, share, press the notification button. We shall be right there to answer you. I sign out.
Ask Dr. UTHUMAN.